Hi, this is Dr. Pete Butkins. Welcome to my video. This video is for parents, spouses, significant others, friends, siblings, children who are really invested in helping someone get sober and clean. I want to ask you to strike while the iron's hot. That's probably the most important thing I can tell you today is don't delay, strike while the iron is hot. You've probably gone through a progression. Most parents or helpers, people that really are caring and loving and want to see someone get better, go through a progression just like the alcoholic or addict does. You go from really wanting help and wanting the person to do well and doing everything you know to really try to help the person and end up getting frustrated because they may not want help yet, or because the way you're helping them is actually putting them in a position where they can use you. So you have to get to the point where there's balance. If you let someone use you long enough, you're going to get frustrated, you're going to get angry, you're going to want to get rid of the problem, you're going to want to detach with anger or frustration. That doesn't work. The key is to detach with caring, with love, let the person know that you really care, but you're not willing to do this anymore. There's a point in between the enabling and the anger or rage where you can really be helpful. In fact, you can be helpful at any time. You could always change your opinion, your thoughts, go back and say, I'm sorry I yelled at you, but I'm not willing to do this anymore. I want you in treatment. When the person's willing to get in treatment, there are some important things you can do. The most important thing is to do it immediately. There's a period called post-acute withdrawal, PAW. There's a period of time that's different for everyone. It can be 10 days, it can be 60 days, it could be 30, it can be 90 days. But there's a period where the cravings come back and the person really, really wants to use again. And those cravings override any love, sentiment, feelings usually, and the person uses. Unless you get them to a point where they can learn the tools not to use. They can abstain with help. I have thought about this for actually over 45 years, and I've realized there is a design, there's a plan, treatment's very valuable. I went through a stage where I didn't think treatment was valuable. I figured if a person was ready, they could go to AA or NA and be fine. But that's not true. There's a lot of other variables to consider. A lot of people won't stay in AA or NA long enough to learn how to think right. To learn how to pray, to learn how to give up to control, to learn how to accept the fact that this is out of control and it is beyond the person. In the treatment center, if you've got a contract and an agreement and a treatment plan, and the person little by slowly can learn these tools they can learn to abstain and enjoy life. There's two parts to treatment. The first part is putting the drug or the drink down. And the second part is learning how to live without the drug or the drink when the stressors come. The key to recovery is how to deal with stress. And the stresses may be there already. You may stop drinking and drugging, or your loved one may stop drinking and drugging, and they may be in a lot of emotional pain. They may get off Oxycontin and find out they can't handle the injury, the pain without something. So there has to be a plan, there has to be structure, there has to be a way to recover that's designed for them. And there has to be some kind of structure. Some people need inpatient. So the first step is to abstain. The second step is to learn the tools to be able to stay sober and clean. Some of the tools involve thinking. A lot of people getting sober at first, and also the family, because you really haven't taken a course in this. How could you know differently? A lot of the people think, well, if I just substitute, I'll be fine. They go back to using. A lot of people think, well, I've got a job now, or I can pour myself into work and that is my recovery. They usually relapse. They usually drink. A lot of people think the same about school. A lot of people get the girl back or the boyfriend, and that's their higher power. They feel secure and safe now. There's no more abandonment, and they feel that they're okay, and they go back to using. A lot of people think if I stay busy, I'll be okay now. A lot of people do feel good the first few weeks of recovery because the drugs leave in the body and they say, I'm okay, I don't need anybody. I can do this by myself, and they relapse. A lot of people think I can try it again. I can use again, because they really don't have an innermost cellular thought change. The thinking has to change from I can do this, I can get away with it, I don't do it in the morning, I only do it on the weekend, I only shoot up once a day, blah blah blah, to it has to change to any attempt at drinking or drugging will result in failure. It has to change to I have to give up my slippery people, places, and things. It has to change to I'm a sick person. I'm not bad, but I'm sick. I have this pre-genetic disposition to addiction. I get cravings. Normal drinkers don't get cravings. I have blackouts. Normal people don't get blackouts. I have a tolerance that varies. Most alcoholics and addicts can put more product into their body than the average person, enough to kill the average person. And it's hard to understand unless you study addiction. It's just like diabetes or cancer. Until you study it, it's very difficult to manage. And we at My Freedom Quest have studied it for a lot of years. We've lived it for a lot of years. We've been there. We've recovered from it. So we really know this inside out. I know it from studying it over 45 years and for being sober and clean 26 years. And going through a lot of pain and loss and death and discouragement and financial difficulty without having to drink or drug. So we know how to do this pretty well. And we care about people. That's our biggest we do care. We're concerned about people, that they get sober and clean. It's a higher calling in life. This is not a moneymaker, folks. It's a higher calling. It's a situation where I've done this for free. I've sat in my group for a year without getting a lot of money for one person, because I wouldn't let other people in that group that were not ready for treatment. And that group's called My Freedom Quest. I call it, the subtitle is Real Recovery, because it has integrity. We don't let people in unless they have a chance to recover. And we don't let them get in the group because the other group members need to have a quality group. Because you don't stay sober and clean in a half-measures group. You have to have people that are really working at this and doing what we suggest. So I have guidelines for treatment that I enforce. So the person really has to get to the point where they be a student of recovery. They got to get honest, they got to be open, they got to be willing to recover. This takes quite a while, sometimes years. But we do a year program and then a year aftercare, and then people come back for alumni after that. I've got people sober and clean 2-3 years, a lot of them over a year. And so what we're doing really works. I'm glad you listened to this video. People have a chance at My Freedom Quest. It's not going to cost you an arm and a leg. It's about $1,600 a month for intensive outpatient. Groups are $40 if they just need 1 or 2 groups a week, if they're willing to go to a lot of meetings and they haven't taken this too far, and there's no anxiety problem, there's no severe depression problem, there's no severe stressors. If a person is at wit's end when they get sober, they need more than just a group or 2 a week in an individual and a marital session. They need the family program, which is strong, and an intensive outpatient program where they get, there's 168 hours in a week. Sometimes they need to get 30 hours of good thinking, inspiration, motivation, and cooperation from others, and love, in order to stay sober and clean. Our number at My Freedom Quest is 407-786-1913. Thanks for listening to this video, and God bless.